Blurry vision returning after cataract surgery can be frightening. Imagine spending time, money, and hope on an operation that promised clear sight, only to find weeks or months later that your world is once again covered in haze. Many seniors across the United States and Canada ask themselves the same anxious question: did my cataracts come back? Did the surgery fail? The shocking truth is, no, cataracts don't grow back, and most surgeries are not failures. Instead, there are specific reasons why vision can become cloudy again, and the good news is that most of them are easily treatable. This is a scenario many people over 60 can relate to, standing in front of the mirror, glasses in hand, wondering why reading labels driving at night or watching television feels harder than it did right after surgery. Has that happened to you or someone you love? If yes, type 1 in the comments. If not, type 2. And don't forget to follow this channel. We'll keep sharing practical health knowledge to help you protect your vision and overall well-being as you age. Today we'll break down why blurred vision can return after cataract surgery, why it's not a recurrence of cataracts, and what doctors do to fix it quickly, sometimes in just 5 minutes. But before we dive into the causes, it's important to remind ourselves of the essential role cataract surgery plays in restoring sight and independence for millions of older adults worldwide. Cataract surgery is one of the most common and successful medical procedures in the world. Every year, millions of Americans and Canadians undergo this operation to replace a cloudy natural lens with a clear artificial one. The results are often life-changing. Colors appear brighter, faces sharper, and everyday activities like reading, driving, or cooking become possible again without constant struggle. It's important to emphasize that cataract surgery has an extremely high success rate. Over 95% of patients experience improved vision afterward. That's why ophthalmologists call it the gold standard treatment for cataracts. For seniors, this surgery not only restores sight, but also protects independence, reduces the risk of falls, and improves quality of life. However, while the operation itself is highly effective, it doesn't mean vision problems will never appear again. Understanding why blur sometimes returns is the next step, and as we'll see, it has more to do with natural changes in the eye than with any failure of the procedure. Now that we've reminded ourselves why cataract surgery is so important, let's talk about the #1 reason vision can become blurry again afterward. It's called posterior capsule opacification, or PCO. Many doctors also call it a secondary cataract, even though it isn't a true cataract at all. Here's what happens. During cataract surgery, the cloudy natural lens is removed, but the thin capsule or bag that once held the lens is left in place. This capsule acts like a clear window frame, and the new artificial lens is inserted inside it. At first, the capsule is transparent and your vision is clear. But over time, cells left behind during surgery can grow across the back of that capsule, creating a cloudy layer. This layer scatters light and makes vision blurry, almost as if someone fogged up the inside of your glasses. For many seniors, the experience feels very familiar. At first, everything after surgery looks brighter and sharper, but months or even years later, text on the television becomes harder to read, night driving feels unsafe again, and glare from headlights creates halos around lights. The worry naturally arises. Are my cataracts coming back? The answer is no. Once a cataract is removed, it cannot return. What you're dealing with is PCO, and while it mimics cataracts in symptoms, it is far easier to fix. Doctors diagnose PCO with a simple eye exam. Under a slit lamp microscope, the back of the capsule shows cloudiness instead of being perfectly clear. The best part. The treatment for PCO is fast, painless, and usually permanent. It's called a YAG laser capsulotomy. In this procedure, the ophthalmologist uses a special laser to create a tiny opening in the cloudy capsule, allowing light to pass through freely again. The process takes only about 5 minutes, doesn't require any incisions, and is done in the office rather than an operating room. Most patients notice their vision improve almost immediately afterward. It's like wiping condensation off a window you can see clearly again. If you're living in the US or Canada, you probably know someone who has had this done. It's incredibly common, with millions of seniors undergoing YAG laser treatment each year. And unlike cataract surgery, which requires recovery time, the laser procedure typically lets you resume normal activities right away. Here's a question for you. Have you or someone you know experienced blurry vision again after cataract surgery? Type yes in the comments if this has happened, or no if you haven't. And don't forget to follow this channel. We'll continue sharing clear explanations and solutions for common eye problems that affect older adults. The key takeaway is this: if your vision becomes blurry after cataract surgery, don't panic. It doesn't mean the surgery failed, and it doesn't mean cataracts grew back. Most likely, it's posterior capsule opacification, a natural and very treatable change in the eye, With modern laser technology, clear vision can be restored in just minutes, helping you continue to enjoy reading, driving, and living independently. While posterior capsule opacification is by far the most common cause of blurry vision after cataract surgery, it's not the only one. Another important reason vision can become cloudy again is due to inflammation or post-operative reactions in the eye. This doesn't mean the surgery failed, it's actually a normal part of the healing process for many patients. But in some cases, the inflammation lingers longer or becomes more intense than expected, leading to persistent blur or discomfort. Here's why this happens. Cataract surgery, though highly safe, is still a surgical procedure. During the operation, the delicate tissues inside the eye are manipulated to remove the cloudy lens and place the artificial one. The body's natural defense system responds to this as a form of injury, releasing immune cells and inflammatory chemicals to help with healing. Normally, this inflammation is mild, temporary, and controlled with prescription eye drops. But for some individuals, especially older adults with underlying conditions like diabetes, high blood pressure, or autoimmune issues, the inflammation can be stronger, lasting weeks or even months. This lingering reaction can cause symptoms like hazy vision, sensitivity to light, and mild eye pain. Some people describe it as looking through a smudged window where everything is visible but never truly sharp. Others notice that glare from headlights or lamps feels more intense than before. For seniors who already worry about independence and safety, especially while driving at night, these symptoms can be unsettling. Fortunately, doctors have reliable ways to manage this problem. Anti-inflammatory eye drops, often steroids or non-steroidal agents, are the first line of treatment. When used properly, they calm the eye's immune response and allow the tissues to heal more smoothly. The challenge comes when patients don't follow instructions closely, forgetting to use drops regularly, stopping them too early, or misapplying them. In such cases, the inflammation can rebound, keeping vision blurred longer than necessary. That's why it's crucial to stick to the treatment plan exactly as prescribed. Another factor is dry eye syndrome, which is common in older adults and can worsen after surgery. If the tear film is unstable, the surface of the eye becomes irregular, scattering light and creating blur. In these situations, lubricating eye drops, warm compresses, and lifestyle adjustments like using a humidifier indoors can make a big difference. Here's something to reflect on after surgery. Did you or someone you know struggle to keep up with the prescribed eye drops? Be honest, type yes if you found it challenging, or no if you managed it consistently. And remember to follow this channel where we break down complex eye health topics into simple, practical advice for seniors and their families. The important message is this: blurry vision after cataract surgery doesn't always point to a complication like posterior capsule opacification. Sometimes it's simply your eye's natural reaction to healing or dryness that needs extra care. By working closely with your doctor, using your medications as directed, and supporting your eye health with good habits, you can move through this phase and return to clear, comfortable vision. Beyond posterior capsule opacification and inflammation, there is another important reason why vision may remain blurry or even worsen after cataract surgery. Other eye diseases that exist alongside cataracts. Cataract surgery can remove the cloudy lens, but it cannot cure every underlying eye condition. For many seniors, these coexisting problems play a major role in how well their vision recovers. One of the most common culprits is age-related macular degeneration, AMD. The macula is the central part of the retina responsible for sharp, detailed vision, what you use to read a book or recognize a loved one's face. If the macula is already damaged by AMD, replacing the cataract won't restore perfect clarity. Patients may notice that while the overall brightness improves after surgery, fine details remain blurry. It's like cleaning a dirty window only to discover that the picture outside is still faded because the canvas itself has worn down. Another condition is glaucoma, often called the silent thief of sight. Glaucoma damages the optic nerve, gradually stealing peripheral vision. Cataract surgery does not stop this process. In fact, some patients only discover their glaucoma after surgery when vision does not improve as much as expected. If untreated glaucoma can continue to progress quietly even in an eye with a perfectly clear artificial lens. Diabetes is another critical factor. Diabetic retinopathy, caused by years of high blood sugar damaging the tiny blood vessels in the retina, can significantly affect vision. After cataract surgery, these fragile vessels may leak or swell, leading to macular edema swelling in the central retina that blurs vision. For patients managing diabetes, this can be a frustrating surprise. The cataract is gone, but vision is still hazy due to ongoing retinal disease. The challenge with these coexisting conditions is that they often go unnoticed before surgery. Cataracts themselves cause so much cloudiness that it can mask the signs of macular degeneration or diabetic retinopathy. Only after the lens is replaced does the underlying disease become more visible. This is why ophthalmologists stress the importance of a comprehensive eye exam before and after cataract surgery. Identifying these problems early allows for better planning and realistic expectations. The good news is that modern medicine offers treatments for many of these conditions. Injections, laser therapy, and medications can help slow macular degeneration and diabetic retinopathy. Glaucoma can be managed with drops, surgery, or minimally invasive procedures. The key is ongoing follow-up care, not assuming that cataract surgery is the final step in eye health. Let me ask you, do you or someone you know live with another eye disease, like glaucoma or macular degeneration, alongside cataracts? Type yes if this is part of your story, or no if cataracts were the only issue. And don't forget to follow this channel. We share practical, easy to understand advice that helps seniors and their families make informed decisions about vision and overall health. The bottom line is simple blurry vision after cataract surgery isn't always due to the surgery itself. Sometimes it reflects the presence of other eye diseases that need their own care. By recognizing and addressing these conditions, patients can protect their sight and maintain independence far beyond the cataract operation. After understanding the main causes of blurry vision following cataract surgery, posterior capsule opacification, inflammation, and other eye diseases, the next natural question is, what can be done to restore clear sight? For most people, the answer lies in one of the simplest and fastest procedures in modern ophthalmology, the YAG laser capsulotomy. Let's take a closer look. As we explained earlier, posterior capsule opacification happens when the thin membrane that holds the artificial lens becomes cloudy. Unlike cataracts, which require surgery in the operating room, PCO can be fixed right in your doctor's office with a specialized laser. The procedure takes just a few minutes, doesn't involve any incisions, and recovery is almost immediate. Here's how it works. You sit comfortably in front of a machine that looks very much like the microscope your doctor uses during regular eye exams. After placing a numbing drop in your eye, the ophthalmologist uses the YAG laser to create a tiny opening in the cloudy capsule. This opening allows light to pass freely, once again restoring clarity. Most patients say they feel no pain at all. Some notice a brief flash of light, but that's it. The entire process is usually over in less than 5 minutes. The results are often dramatic. Many patients walk into the clinic with hazy vision and leave the same day seeing clearly again. Colors sharpened, text becomes easier to read, and driving at night feels safer. For older adults who may already worry about losing independence, that kind of immediate improvement can feel life-changing. Of course, like any procedure, there are considerations. While YAG laser capsulotomy is extremely safe, there is a small risk of increased eye pressure swelling or retinal detachment. That's why your doctor will usually check your eye pressure after the procedure and schedule a follow-up visit to ensure everything looks good. Compared to the risks of untreated cloudy vision like falls, accidents, and loss of independence, the benefits of the laser far outweigh the risks. It's also worth noting that the YAG procedure is a one-time solution for posterior capsule opacification. Once the cloudy part of the capsule is opened with the laser, it does not grow back. That means patients rarely need to repeat it. For many, this quick visit to the eye doctor provides lasting clarity for years to come. Here's a question for you. If you had the chance to restore your vision in just 5 minutes, would you take it right away, or would you wait and see if the problem worsens? Type now if you'd do it immediately, or wait if you'd hold off. And remember to follow this channel. We're here to help you stay informed and confident in every health decision you make. The key message is this modern technology has made it possible to solve what once felt like a discouraging problem in just minutes. If your vision becomes blurry after cataract surgery, don't panic. Ask your doctor about the YAG laser capsulotomy. It may be the fastest and most effective way to bring clarity back into your world. While YAG laser capsulotomy offers a powerful solution to cloudy vision, after cataract surgery, prevention and ongoing care are just as important. The truth is, protecting your eyesight doesn't end once the cataract is removed or the laser clears your capsule. Your eyes continue to change with age, and how you care for them afterward makes a big difference in how well you see for the rest of your life. The first key step is regular follow-up visits with your ophthalmologist. After cataract surgery, most doctors recommend a series of checkups within the first day, the first week, the first month, and then, as advised, depending on your progress, These visits allow your doctor to monitor healing, catch early signs of complications like inflammation or pressure spikes, and address issues like posterior capsule opacification before they severely impact your vision. For older adults, skipping these follow-ups can mean small problems go unnoticed until they become harder to fix. Another essential factor is proper use of medications. After surgery, you'll likely be prescribed a combination of anti-inflammatory and antibiotic eye drops. These drops reduce swelling, prevent infection, and support healing. However, many seniors find it challenging to stick to the schedule, especially if multiple medications are required at different times of day. Using a chart phone alarms or asking a family member to help can make adherence easier. Remember, even a few missed doses can slow healing or increase the risk of complications. Beyond medical care, lifestyle choices play a big role in long-term eye health. Protecting your eyes from UV rays is crucial since sunlight exposure can accelerate damage to the retina and increase the risk of macular degeneration. Investing in a good pair of sunglasses with UV protection isn't just about comfort, it's about preserving vision. Similarly, avoiding smoking, which damages blood vessels and increases oxidative stress, can significantly lower your risk of further eye disease. Diet also matters more than most people realize. Foods rich in lutein, zeaxanthin, omega-3, fatty acids, and antioxidants help maintain retinal health and may slow the progression of conditions like macular degeneration. For example, leafy greens such as spinach and kale, fatty fish like salmon, and colorful fruits like blueberries can all support healthy vision. In North America, where processed foods are common, consciously choosing eye-friendly foods is an investment in both vision and overall health. Managing chronic conditions like diabetes and high blood pressure is another cornerstone of prevention. As we discussed earlier, diabetic retinopathy and hypertension-related eye disease can worsen after cataract surgery if left uncontrolled. Keeping blood sugar and blood pressure in check through diet, exercise, and medication adherence directly translates into healthier eyes and clearer vision. It's also important to be mindful of daily habits. Avoid rubbing your eyes, especially in the weeks after surgery, as this can disturb healing tissue. Use artificial tears if you struggle with dryness, which is common in older adults, and can make vision fluctuate. Small adjustments like using a humidifier in winter or staying hydrated throughout the day can keep your eyes more comfortable. Now, let me ask you, after any surgery, do you tend to be diligent with follow-up care and medication, or do you sometimes let things slide once you start feeling better? Type diligent if you're careful about follow-ups, or forget if you've struggled in the past. And remember to follow this channel. We'll keep sharing practical steps that make eye care easier and more effective for seniors and their families. The bottom line is this: while modern surgery and laser treatments can restore clarity, your long-term eye health depends on prevention and consistent care. By attending checkups, using medications properly, making smart lifestyle choices, and managing chronic diseases, you can protect your vision for years to come. Think of it not just as taking care of your eyes, but as preserving your independence, safety, and quality of life. We've taken a full journey together through one of the most common worries seniors face after cataract surgery, the return of blurry vision. Along the way, we learned that this doesn't mean the cataracts have grown back, nor does it signal a failed surgery. Instead, we discovered three major reasons for this problem: posterior capsule, opacification, inflammation, or healing reactions, and other coexisting eye diseases like glaucoma, macular degeneration, or diabetic retinopathy. Each of these has its own explanation, and more importantly, its own solution. We also explored the power of modern technology, particularly the YAG laser capsulotomy. In just 5 minutes, this simple procedure can restore clear sight for millions of patients, often with immediate results. Combine this with smart preventive care, consistent follow-ups, correct use of medication, protective lifestyle habits, and management of chronic conditions, and you have a strong foundation for lifelong vision. But here's the truth: knowledge only makes a difference if it leads to action. Too many seniors accept blurry vision as an inevitable part of aging. They tell themselves, "I've already had surgery, so nothing else can be done." That belief is not only discouraging, it's dangerous. Poor vision increases the risk of falls, accidents, and loss of independence. Yet in so many cases, the solution is right at hand, whether through a quick laser procedure or a change in daily habits. So I encourage you to take the next step. If you've noticed your vision getting cloudy again after cataract surgery, don't ignore it. Schedule an appointment with your eye doctor and ask whether posterior capsule opacification might be the cause. If you've been prescribed drops, make sure you're using them exactly as directed. If you live with diabetes or high blood pressure, double down on managing those conditions, not just for your overall health, but for your eyes as well. Let's make this interactive. Have you or someone you know experienced blurry vision after cataract surgery? Type yes if this story sounds familiar or no if not. Your answer could reassure another viewer who feels alone in their struggle. And don't forget to subscribe to this channel. By joining our community, you'll gain regular insights into elderly health, practical solutions, and encouragement to keep your independence strong. Your vision is not just about seeing clearly. It's about recognizing loved ones' smiles, reading stories to grandchildren, safely driving to visit friends, and enjoying the world in full color. By taking action today, you protect not only your eyes, but also the freedom and dignity that come with them. Remember, your cataracts won't grow back, your surgery was not a failure, and blurry vision has solutions. The choice is in your hands. Don't wait until it's too late to reclaim the clarity you deserve.